We're going to be talking next about the instructions for the Neuman assignment. For this assignment, we'll be utilizing the information gained from our readings about Betty Neuman and the Neuman systems model. Before viewing the client interaction, pause this video and print out or open both the grading rubric for the Neuman assignment and the care plan template to take some notes. Also print out the Neuman assignment case information for your review. All of those things can be found in Angel. Our scene that you're going to see shortly opens with a nurse entering the client room to begin the assessment phase of the nursing process. The nurse will be interviewing a client upon admission to the hospital. While you are watching the interaction, consider the following. What information fits in the normal line of defense portion of the care plan template? Remember, the normal line of defense in the Neuman systems model represents the stability of the client system over time, the normal wellness state for the client. So what about our client would be considered her normal wellness state? Take note, as this information should be entered here. Additionally, write and number each of the 5 variables under the stressor column on the care plan template. Remember, in the Neuman systems model, the 5 variables are physiologic, psychologic, sociocultural, developmental, and spiritual. As you watch the video, try to identify a stressor in at least 3 of these variables. In the next column on the care plan template, entitled Response to Stressors, identify how our client responded to the stressors that you have listed under each variable. So I would like to see 1 stressor identified from at least 3 of the variables. Enjoy the video.
Hello.
Hi.
My name's Sam. I'm going to be your nurse today.
Nice to meet you.
Nice to meet you as well. How are you doing?
I'm alright.
Alright. So what brings you into the hospital today?
I have a sore throat and I haven't been able to sleep well lately.
Okay.
I'm sweating at night.
Okay. I have to ask you a couple of questions that we normally ask upon admission, and it'll take us a little while, but we'll get through it, okay?
Okay.
And I want you to be as truthful and honest with everything that you have as you can possibly be, alright?
Okay.
Any past medical illnesses or surgeries that you've had in the past?
Nope.
Okay. Any history of chronic disease, like high blood pressure or diabetes or anything like that?
Nope.
Alright. And you've had all your immunizations?
As far as I know.
Okay, and I can look that up online a little bit later too. I just want to give you my full attention in the meantime. Any smoking history?
Nope.
Alright. Do you drink any alcohol?
Not really.
Not really, as in no, not at all, or occasionally?
Occasionally.
Okay, like a drink a week or something like that?
Yeah.
Okay.
Or a month. One of the 2.
Okay. Any other drug use that you know of?
Nope.
Okay. Any medications that you're on at home right now?
Just a multivitamin.
Okay. Any allergies that you know of?
Nope.
Okay. How are you feeling right now?
Kind of under the weather.
Under the weather? Alright.
Yeah.
So, when you say under the weather, you just not to your normal standard where you would be?
Yeah, probably.
Okay. You exercise on a regular basis?
I have 2 kids. They keep
Exercise you enough? I hear ya. I hear ya. I don't have any kids, but I've heard stories about it, and
they keep me busy.
I'm sure they do. I'm sure they do. And for your kids, you use car seats and everything like that. You follow the normal.
Yep.
Okay.
Yep.
Good. At home, you feel everything is safe at home right now?
Yeah. Yeah, pretty much.
You're hesitating a little bit.
Well, I went through a messy divorce recently, and my ex he wasn't the nicest guy. So,
Okay.
But things are good now. We're
Good.
safe now.
Okay. So he's not in the house with you anymore?
Nope.
Okay.
Nope.
And how long ago did this happen?
About 9 months ago.
Okay. How has your appetite been recently?
It's hard to eat with my sore throat, and I've been having a lot of diarrhea, so I
Okay.
haven't been eating as much just because it's easier not to.
And going to the bathroom pretty regularly or not? With the diarrhea, obviously.
Yeah,
Okay. And urination, how's that been?
that's fine.
That's okay? No burning or anything like that?
Nope.
Okay.
Nope.
Okay. How long has the sore throat been going on for?
About a week. A
Okay.
week, 2 weeks, maybe.
Okay. And do you remember when it first started? Like what had happened that it had first started?
No, I think I just woke up with it one morning.
Okay. Do you know where you might have gotten it from at all?
There's a guy I'm seeing and he was sick, I
Okay.
think a couple weeks ago, so I could have gotten it from him, but it was never as bad as mine.
Okay. So your sore throat's been going on for about 2 weeks. What prevented you from seeing anything? Because a sore throat that's been going on for 2 weeks that's a pretty long time.
Yeah. I don't know. I don't really have the money for it right now. Insurance isn't the greatest, so.
Okay. Okay. I know that can be difficult. Do you have any assistance when it comes to monetary issues?
Like as.
Do you have insurance or anything like that?
Yeah, but it doesn't cover much.
Okay. Okay, and we can look into that a little bit later too. I just want to keep that in the back of my head. And you said you exercise. Everything's been working well with your ticker?
As far as I know.
No issues there. Sleeping. How have you been sleeping with that sore throat?
Not the greatest. I've been waking up a lot with sweat, being all sweaty and.
Okay.
Yeah, not the greatest.
All right. So you live alone currently, correct?
With my 2 kids.
Okay.
Yep.
And the divorce happened a couple weeks ago or a couple months ago, you said?
9 months ago.
9 months
yeah.
ago, sorry.
That's okay.
And after you got divorced, did you feel better or worse than when you were married with your prior husband? Because that can have an effect on your health too.
I guess I was better. It took a little bit, but it's been a lot better now.
Okay. Overall, how is your outlook on life?
Now?
Yeah, now. Compared to before.
Oh, a lot better. I feel good about where my daughters and I are headed.
Okay, no thoughts of harming yourself or
Oh,
harming
no,
anyone else?
no.
Good. We want to ask that just to make sure. And I know you've had a lot of different kinds of stressors in your life.
Yeah,
So.
I understand.
Any concerns about your illness at the moment?
Just hope it gets better. I got a couple. I'm a realtor, so I got a couple open houses next week. So.
A little worried about that and how
Yeah.
that could affect things?
Yeah.
Okay. All right. So, you said this sore throat started possibly after a boyfriend?
Yeah.
Okay.
Yeah.
And are you sexually active at the time being? Right now?
Yes.
You are?
Yes.
Okay. Multiple partners, one partner, just the one
Just
boyfriend?
him. Just
Okay.
him.
Do you know how many people he slept with in the past?
No.
Okay. Any history of sexually transmitted diseases at all?
Not that I know of.
Okay.
I would hope not.
Okay. This is kind of invasive, and I apologize in advance for that. Last menstrual period.
About 2 weeks ago.
2 weeks ago, and you're having them pretty regularly?
Oh yeah. Yeah.
Okay. And your pregnancies went okay?
Yep.
And how many births did you have?
Just
Just
the
the two?
two.
Okay.
Just the 2.
Anything else pregnancy-wise that happened? Okay.
No.
Any religious issues that you have?
Not
that you-
issues. No.
Anything that you want us to take care of while you're here?
No. I mean, maybe my pastor could come and
Okay.
visit.
I'll definitely make a note of that and make sure we pass that on to everybody.
Okay.
Any religious restrictions or practices that you wish to follow while you're here?
Nope.
Okay. All right. I just want to do a quick physical assessment to just give a whole picture to the doctor if I could do that.
Sure.
All right. So I'm just going to take a listen. Any deep breaths for me? All right. If I could take a quick look in your mouth too. How long have you had those white spots there?
Oh, I don't know. Maybe a few days.
Okay. You seem pretty upset right now. Is everything okay? I mean, do you have any pain issues that I can attend to right away?
No. I just got a phone call from one of my friends. She saw my boyfriend out with some trashy person.
I'm so sorry. I am so sorry. That must be very difficult for you.
It's alright.
To rule out. So I'm going to go talk to the doctor, give him my whole opinion on the matter, and we'll go from there, okay? And if there's anything that I can do for you in the meantime, let me know right away, okay?
Okay.
Okay.
Thank you.
You're welcome.
Okay, you should have identified a great deal of information from the video. For example, I have listed under the normal line of defense that our client is a 29-year-old divorced female. She's a mother of 2. She works as a realtor, and she has no significant prior medical history. She has no allergies. These are a few of the things that I have identified from watching the video. Did you find more? I have found a number of physiologic stressors as well. Just 2 of them are night sweats and throat pain. So I might label them under the physiologic variable as A and B, night sweats and throat pain. So how did the client respond to those physiologic stressors? So again, the next column would be response to the stressors. Well, her night sweats are causing her sleep deprivation, and her sore throat is preventing her from eating well. Can you find a few more? How about some psychologic stressors? She wants to get home to see her children, and this seems to be causing her anxiety. So we could put under here that she has a desire to go home under a physiologic stressor, and her response to that stressor is anxiety. Hopefully you can determine a few more than that. Additionally, I heard her say that she is concerned about being discharged so that she can get back to work. The response to that socio-cultural stressor of not being able to work while hospitalized seemed to cause her some financial concerns and anxiety. Review your report information and the video to be sure that you are identifying areas of stressors and the client's response to those stressors. After you have compiled this information, identify areas of concern within the stressors that you feel are most pertinent or the priority for this hospitalization. This information will be the basis for your nursing diagnosis. Remember, I'm asking that you write a 3-part nursing diagnosis that is in the PES format that we talked about earlier: problem, etiology, and signs and symptoms. I'll do an example one with you for this particular case. Okay, Danny was complaining of anxiety due to her missed work while being hospitalized. So let's write a 3-part diagnosis for Danny with the stressor in mind on the board. So we have the anxiety related to hospitalization and the resultant inability to work. As evidenced by her statements of needing to get home, and then the things that you saw, like the restlessness that she had. So again, going back to our previous nursing process video that we talked about, here's your problem, here's your etiology, here's your signs and symptoms. This is how you saw and understood that this was the problem and this is the cause of that problem, so your 3-part statement. So now try to write another diagnostic statement on your own. After you write your diagnosis, write a goal and outcome statement that directly relates to the diagnosis. Remember, the goal or outcome, if met, should mean resolution of the identified problem or nursing diagnosis. We will not be writing any preventions or rationale with this case, but we'll revisit this topic in your future courses. The preventions and rationales would be our nursing interventions, but we will not be covering that information quite yet. Those areas of the care plan can remain blank when you turn it in. Finally, we'll be watching the RN, Sam, discuss with his client Danny his thoughts about the stressors he has identified through his assessment as they work to develop a plan of care together. Pay attention to our nurse and client, as you may get additional information to help you complete the diagnosis and outcome goal statement.
Hi, Danny.
Hi.
How you doing?
I'm alright.
Okay. Any other phone calls while I was gone?
No.
Okay. Well, I've talked to the doctor, and he's formulating his plan of care for you medical-wise, so we're going to follow that to the T and figure out what's going on. But I've also made a nursing plan of care, and we're going to go over a couple of those things that I'm a little bit worried about, and we'll see if they match up with what you're thinking right now.
Okay.
So I'm a little worried about that you might be at risk for fluid imbalance because you've got all that diarrhea, and you're not taking a whole lot in because of your mouth sores. I'm also worried that you might be at risk for infection because you have those open sores in your mouth and your immune system is compromised at the moment. And I'm worried that you're anxious because you have financial constraints right now related to your family situation at home and not really great insurance. So
yeah, I'm worried about my daughters, but
okay, I can write that down too. I'll definitely add that into our plan of care.
I just want to feel better. I just got to get out of here, and I got to figure out what's going on.
Okay. Well, is there any one that seems most important to you right now at the moment that we can work on right away?
Just getting better and figuring out what's the next step.
Okay, so we can get you home.
Yep.
So home is our biggest concern right now. We
Yep.
want to get you back home so you don't have to stay too far away from your daughters.
Yeah, they're my life. I need them, especially right now.
All right. Well, we'll take care of that.